The observer would like to advise that the following video comes with a trigger warning. The content in this video is of a sensitive nature, so please beware that the topic of this video may trigger you. The observer recommends that you consider your own mental health before you watch this video.
But yeah, no, I should have, so this is a big bottle and it runs over a pump and I've got fluid as well. So it's not a certain amount of feeds, it's a certain amount per mil, how many mils I have, so yeah. But I don't get that at the moment, which is why I also have to have other stuff, but as in, like, I was on IV fluids, but my IV line is at the moment broken, so we've got to, do I get on with it? What do you mean, the feed? This feed has been the best one for me, but the feed is just, yeah, not. Jejunal feeds aren't the best option for me. The Dexcom, oh yeah, it's alright, lovely. Actually, I've gotten better with it than the Libra, but no, it's not actual food. Am I allowed to eat? I'm not. I'm allowed to drink, but it all drains out. So this is my drainage tube. That's draining what I've just drunk a minute ago, but no, I can't eat food anymore, lovely. I used to be able to eat and drain out, but not anymore, love. But no, it's not blended food. It's literally basically just all the nutrition you need in like a milkshake type formula, I guess. How am I? I'm okay. Does the drainage go straight into a drainage bag? Yeah, some people with tubes can eat. This is my drainage bag here. And it's obviously attached to me in a cover, but yeah. So I like to cover it up most of the time. Sometimes I can't be bothered, but sort of. But yeah, obviously it can't be pushed in. It has to be run through a pump because mine's an NJ that goes into my intestines. So yeah, you can't push it in. It has to be run through a pump quite slowly. Unfortunately, I wish it could be done faster because, to be quite fair, I just hate being connected to a pump all the time. But yeah, it's like a milkshake. Test pH, the drainage one. Oh, I did, Bethan. I'm sorry, I forgot. Yes, I did, lovely. Thank you so much. My carer brought it in. My bowels don't work properly, lovely, but they never have, so yeah. pH is the drainage one. I test the pH upon inserting it, but yeah, that is it really, because you don't need to test it while it's in situ and in the right measurement. How do I keep myself upbeat? Just have to. On one, it's not too bad. On two, it's a nightmare. So on one, I can put it in a backpack. On two, pain in the ass. I mean, you can fit two in a backpack, but my backpacks just aren't big enough. And the backpack they supply don't have space for two. So why do I have two? Fluids and feed, lovely. Did I miss something, lovely? Was that the point I was meant to? Hey B, lovely, how are you? I don't know what you even said, but yeah. But yeah, please don't say it again if it was overstepping. They're not pre-cut, lovely, I have to cut them myself, but yeah. 5 hours, bless you. They took a lot while I was in hospital. Yeah, we don't talk about other creators or other people in this live. It's just not fair on them either. My feelings don't. It's okay as I can be, lovely, thank you. Honestly, my nose is running like hell. I can't, I haven't got any tissues in it. Hot, hot, hot. Not especially. I sometimes get a sore throat, so if I have a cold anyway, then yeah, it'll be extra painful, but it's not too bad. I don't know why I'm so hot, honestly. Have I got a fan on? No, I might get my little fan. That's a good idea, lovely. Thank you. Got my mini fan. A mini fan that just plugs into USB. Haven't got an underlying infection, I don't think so. I'm just used to it, lovely. Is my heating on? It's been turned down, but I think not enough, but yeah. Why is one tube a little bit shorter? It's a lot shorter, love, but it's because it's an NJ, so it goes in further. They're different, love. So yeah, one's an NJ, one's an NG. One goes into my stomach, one goes into my intestines. Occlusion out of pump. I didn't open it, that's why. Helps if I open it. The NG I'm allowed to because I'm trained. The NJ, no, lovely. The NJ can only be done in hospital. It's for meds, feed and everything basically that goes in me. Yeah, Chloe, you included, darling. Hey Emma, darling, are you alright, sweetheart? Do I miss tasting food? Not really, you just become used to it, although I do get taste through drinks. I drink things that obviously have like, it's monthly. No, an NJ goes into the intestines, a PEG goes into the stomach. An NG is pretty much the same as a PEG apart from goes into the nose, through the nose. So the NG is, you test the pH when you put it in, and the pH would be acidic, but yeah, I'm trained. I'm trained, so that's why I know, because yeah. I'm sending you so much love, Chloe, darling. I have a suprapubic catheter, so I've heard of perinatal for perinatal dialysis. I have a suprapubic catheter for urine drainage, but yeah. I can drink whatever I want because none of it absorbs regardless, it all drains out, but not really because, yeah, I don't absorb it and it drains out regardless. I'm sending you so much love, Emma, darling, and we're here for you, sweet. Please remember that, doll. Hard sweets occasionally, but not very often. Right, I've got a Monster here right now. This is purely because I like the flavour, but yeah. I've been in hospital, sweet, but I'm alright, my lovely. Yeah, literally. Don't worry, they're gone, babe. Yeah, they was so lovely. Literally. It doesn't matter, Melissa, darling. This is the Ultra Rosa. I really like this one. Again, unfortunately. So my feed and my fluid. My fluid will take 10 hours, my feed will take 22, but that won't finish it. This is probably one of my favourite ones. My carers are allowed to take me out. Yeah, all of them are allowed to be taken out. The pineapple one, the gold, because yeah, I like the gold one, ultra gold. An hour or two? No, it goes through at like 40 mils an hour. So 40 mils is like probably that much an hour, if that makes sense. So yeah, obviously it's has to run continuously to get enough in me. Sour. Ooh. It can get blocked occasionally, but not really, because it's just fluids. It gets blocked if it's really thick stomach acid or bile coming through, but yeah. Because that's all I can tolerate, unfortunately. And because it goes into my intestines, in general, it will go slower into the intestines, but yeah. Okay, thank you. I've never had it, lovely, but I probably would never even risk it. It wouldn't absorb, so it wouldn't, I can say it probably wouldn't do any damage, but I wouldn't even try it. I don't think so. I know, lovely. I don't watch anything. I know. I'm aware. Oh, Nikki, hello, sweet. Should I get something sorted? Yeah, my electrolytes are up here now, love. These are my electrolytes. I just forgot to bring them through to the other room. To be quite honest, I don't have a different device regardless. Hey Alan, my love. Yeah. I don't own a TV in my house, to be honest. Quite frankly, I literally have no TV in my house. Sunflowers. Yeah, I think so. Yeah, I know who it is, lovely, thank you, but we don't name people, so can we just like we're gonna mute that comment just for 5 seconds, just because we don't name people in here. Regardless of how hateful they are, we don't like to name other creators, thank you. Fair enough. I didn't see it, lovely. I'm just gonna Chloe, I'm gonna come off and come back on. Give me a second. I'm gonna come off and come back on because there's one thing I need to do and I know what I need to do. I'm not, darling. No, not at all. I'll be back in a little bit, guys. One sec. Sorry, I'm back. Hi, Gracie. Hey, Chloe Louise. How's my day been? Yeah, not the worst in the world, lovely. Got out of hospital, so happy about that. Hey, Gracie. Hey, Emma. Sorry, I'm back, guys. I had to sort something out quickly. One sec. God, we've got a lot of Emmas in here. Hey, Ladybug. Am I okay, Lauren? Yeah, I'm okay, sweet. Thank you. Thank you, lovely. One second, I've got a message. That's it, you're going. Go then. I'm not bothered. Good name. Emma is a good name, literally. Hi, heart transplant kid. How are you? Hi, Louise. Well, literally, like, say you're gonna go. Oh, that's it. I'm going. Please do. Like, if you don't want to be here, like, go. Like, I'm not holding you here. Do you get what I mean? Like, literally. Like, it's your free will to come in here. So if you don't want to be here, don't be here. Simple. Sorry, but it's the truth. People don't like that these days, do they? No, I haven't, lovely. Oh, God, now this fan's like got dust in it. Hey, Melissa, thank you. This fan's got dust to make me like even more like sniffly. Sorry, guys. It's horrible. I look fed up. I'm not fed up, darling. I'm fine. I'm fed up with this snottiness. Like, sorry, that's gross, but like, yeah. Picked up a cold off a carer, which really annoys me. They wear PPE, but it's like, oh, I don't know. There's one carer that doesn't wear PPE and she's off sick. Wonder who gave me the cold. Do I like reading? Not really anymore, lovely, just because I really struggle with my eyesight. Especially with, so I'm on a medication called Keppra for my seizures, and unfortunately it causes light sensitivity to some people. Exactly. And it has caused light sensitivity to the fact where, yeah, basically I can't see properly reading on certain lights, and I have lights that switch colour so I can alter them, but yeah, it just annoys me. I actually don't, Shan, no. I don't struggle with everything, love. You clearly do, to say that to me. Bullies only take things out on themselves, out on other people. You don't have effect. No, I don't have any other side effects. It is a known side effect though, lovely. Not everyone has the same side effects to other medications, but yeah, to the same medications even. Hi love, how are you? Shan, quite frankly. Really? I'm feeling better. I'll be alright, lovely. Hey Megan, darling. How are you, sweet? Hey Kira. New glasses? No, these were my first pair, lovely. These were my, when I got my new glasses, like, no, light sensitivity is a side effect of Keppra, lovely. It's a side effect of the medication. It's not the same as photosensitive or light sensitive epilepsy, lovely. It's different. And it is a side effect. You can look it up. Like, and it's different for everyone, can I just say? So, yeah. Oh, God, no. I thought I'd broken. Oh, the screw's coming out again. Like, everyone experiences different side effects to different medications. So, literally, like, I don't know what you're trying to say. Like, literally. How long have I been on it? About 2 or 3 years, lovely. So, yeah. Exactly that. It says it on the BNF, and just how long you're on it doesn't say anything, lovely. Yeah, literally. Side effects can come and go, so yeah. But the fact is, the medication helps, like, so I have to be on it. I have epilepsy myself, love, so I don't know why you're judging me, so yeah. Exactly that. And some people get no side effects of medication, whereas other people get loads, so. Honestly. Yeah, these glasses are like basically broken now. Exactly that. Yeah, I've never had Keppra rage either. A lot of people I've heard of say that, but yeah, I've never had that. I'm just grateful it's nothing like Keppra rage, to be honest. Like, light sensitivity I can deal with. I've just broke my glasses. But yeah, like, you know, Keppra. Yeah, literally. Screw just fell out, honestly. Now where do I put them to keep them safe? I need to get... Okay. I literally can't see right now, Chloe, like literally properly, so give me a minute, babe. I take sumatriptan for migraines, babe, sometimes, if they're really bad. But that, I am. Not free, but yeah. Roxy, there's so many more side effects than that, honestly. Not completely free, but yeah, I get an NHS voucher. Oh my lord, I've just lost the screw already. What have I just done with that? 1 second, guys. I'll pause for a minute. Not really. My carers take me out sometimes, but not much at the moment because of my seizures, lovely. So it's got to be a good day, and yeah, there's not many of them at the moment. We're working on it, but terrifies me with, yeah, contact lenses and the fact of my epilepsy and just eyes rolling, like, nah, I can't even bear that thought. I know, I'm aware, lovely, thank you. What's the blue stuff? That one's oxybutynin. This one is diazepam. No, I don't. I have to have people with me while I'm out and not at home because I don't have anyone to be with me. I should have 24/7 care, but we are still waiting for care package reviews So my care package has been increased and is still waiting to be increased more, but we're going through CHC panel, well, funding. So yeah, like we're just waiting essentially. So it's taken a while to get a confirmed full diagnosis. That's okay, lovely. Plus also, to be honest, like they recommend having someone with you all the time. I don't know how I feel about having someone in my house all the time with me. In all honesty, like, yeah. Because it's not like it would be my mum or my dad or someone with me. It would be, yeah, it'd be invasive. Because they were going to put me in like a nursing home type place. But obviously where I live as well, I don't actually want to be in a nursing home because they're all 60 plus. They were going to make an exception for me. Yeah. Diazepam can come liquid. I don't have liquid because my dosage is too high. Exactly that. I do not want to be there at 25, precisely. I do not want to be in what would probably be a lot of dementia, like residents or clients, whatever you want to call them, 25 years old with them shouting at night time. And I just, yeah, I want some independence, exactly that. They are, like I say, increasing care packages, but I want as much independence as I can have. There needs to be more places with people who have physical disabilities that are younger and that don't have like mental health essentially, because there's lots of mental health places or learning difficulty places or residential for elderly, but not for young with disabilities, with not mental health or, yeah, not with mental health or not with, you know, not that affects them every day like, you know, someone else that would need it more. It's so frustrating, honestly. It winds me up so much. Does my mum not care for me? My mum does care for me, love. My mum and dad both care for me, but I have carers because I don't want my mum to be my full-time carer. And I can't live with my mum and dad because of my disabilities. Their house is not suitable, lovely. Curse of Rempy. Bless you, thank you. Yeah. As I say, yeah, there is a lot of people with physical disabilities in nursing homes because it's a nursing home, but they normally come with elderly a lot more. We don't have any ones with young people. So I do have a care package, but we're just... Okay, thank you. I need a holiday, honestly, I get you. You love your sport living. Oh, yeah. It's just like people have said, it's a postcode lottery, and I don't live in one of the most funded areas, shall we say, so shit pot, really. Yeah. Shit pot of money, essentially, in my, you know, in my area. No, there's not. Changing my stickers. No, I use adhesive remover wipes and then Cavalon to protect my skin over top of my skin. Yeah, can I come, Jess? You know you'll have fun. See, my housing is adapted, but some of the adaptations had to be put in place when I'd already moved in by the council. Because obviously I do have an accessible bungalow, but some of it had to be sorted out, and I was in hospital at the time waiting for somewhere to live, as well as for my physical health anyway. So mum and dad got given 2 weeks essentially to renovate certain parts of it to make it like more suitable, and the council wouldn't have done it. And also, like, so they've done the front door, it had a tiny step that I couldn't get my wheelchair in. So that got done by the council, but for my kitchen, the council wouldn't lower the whole kitchen. They would only let my mum and dad lower one side. Other things have been done by the council, but that just one was like, well, why won't you let us lower the kitchen? Well, she doesn't need it, she's tube fed. And it's like, yeah, but I would still like to make a cup of tea or coffee, which I can have, thank you. Like, ugh. So they wouldn't do my kitchen on the point of like, I'm tube fed. And that I don't need to get to a sink. I need to get to a sink. Silly people anyway. They go, well, our carers can do that. Oh, whatever. Don't forget the van. Exactly that, lovely. And I want to be as independent as possible, like... Oh, thank you, Biscuit. I appreciate that, lovely. Exactly, it seems very discriminatory. And the fact that they wouldn't do it in the first place, but yeah. I can feel my meds going down it because they're pushed quite fast and it's into my intestines, so it hurts, yes. Yeah, so they did that in my bathroom too. But they fitted a new toilet and they focused on the toilet and the bathroom. I can't even use the toilet. You're delusional for believing all that crap, mate. I think I know what I live with and what happens in my life every single day, love. Who's the delusional one? But yeah, literally, the toilet was too low. I can't even get to a toilet to go to the toilet anyway and can't feel it. So like, why did they focus on the toilet and put in grab rails in the bathroom when that's not what I needed? But they wouldn't do the kitchen. Like, really? Oh, bless you. How do I cope? Precisely, Stitch. How do I cope? There are accusations. It's nothing more. Like, they don't have any truth behind them and they have no idea what I lived through. So, quite frankly, it doesn't bother me at all, lovely. Why would it? Like, why would it bother me when people are making accusations but they're not the truth? If people knew the truth or actually listened to the truth from me, you know, whatever, but I mean, it's Kate, so request. Okay, lovely, no worries, Kate, thank you. I will accept later on when I come off. So yeah. Super Chloe, you are. There is. I could post medical information, which I'm not going to do all over TikTok. Thank you. Yeah, sending you so much love. Exactly. Exactly, and I'm not going to post all my medical information over TikTok for the whole world to see. Precisely that. I don't need to. It really doesn't bother me. And I don't feel the need to justify to anyone or justify to some individuals that just don't like me because they'll pick fault in it regardless. I've got proof on here of my wheelchair and of some of my stuff, you know, like that my bed was given to me that they were hating against beforehand. They're still hating against it. They haven't stopped. They still hate. So whatever, it's just, yeah, I don't really care. Like, I've posted proof that my wheelchair wasn't bought and that it was given by Wheelchair Services, but do you know what? Do they believe it? No, because they won't believe other things. Like, they won't believe what they don't believe. So yeah. My bed is horrible, lovely. I hate my bed. It's okay, Molly, honestly, it's fine. You haven't upset me, love. Honestly, hospital beds are horrible, lovely. They're not comfy at all. I have to have it as a need, but it's not comfortable. Like, I was given to, you know, yeah, my chair's from Wheelchair Services. Exactly, precisely that. What's the blue stuff? It's a medication, lovely. A lot of my medications at night time are blue. That was oxybutynin. And yeah, to be fair, it's not only me, it's quite a few people at this point, so that says enough about them, really. So I'm just doing my nighttime medications. Yeah, the wheelchair, yeah, you have to be fitted for the right size, exactly that. And I've even posted my prescription. I do, personally. You don't have to, but exactly. I do a flush in between each medication purely to get fluid into me. I've had nasal tubes for your nose won't close up. I've had nasal tubes for about 20 odd years, lovely. And I've also had a Peg J for 3 years. And the Peg J failed, so unfortunately I have to have nasal tubes. I get what you mean about the septum eventually getting smaller, like the inner bridge of your nose getting smaller and getting scarred, but it doesn't close up, they can still get them in. Mine's an NJ, so it goes into my intestines, it's not an NG. But peg or button feeding is not an option for me anymore, unfortunately, so yeah. Nasal tubes are my only way right now, so I can't say it won't change in the future, but this is what they're saying right now, so this is what I have to stick with. They don't hurt. I've had them for over 20 years, lovely, I'm quite aware. And this isn't an NG anyway, they fit it through endoscopy. Will this be for life? I can't say yes, certainly. They think it will be, but, you know, they don't hurt. They hurt when they're placed. This one does. This one doesn't. I can place this one myself. So one's an NG, one's an NJ. But yeah. So I can't say, yeah. But I've had second opinions on surgical tubes, and because of my genetic condition, it's just actually not viable that they can place another surgical feeding tube, so. No, I know, lovely. Unfortunately, my paralysis is deemed permanent, but again, I can't say for certain, but yeah, they have said it's permanent, but who knows? Miracles might happen. I really bloody hope they do. Exactly. Support and love all the way. I have had physio. I had physio for 8 months inpatient in hospital to regain the ability to sit up after I became paralysed, to get my sitting balance and to be able to transfer with a banana board into my wheelchair. I haven't been paralysed my whole life. I'm not going to be talking too much about my paralysis, only because actually it's quite a sore subject, because in general it could, I personally think it could have been prevented, but you know, I can't prove that for sure. But yeah, we're not going to talk about that too much because it's just, you know, it's ruined my life, so in some ways. Well, in a lot of ways it's changed it regardless, so yeah, it's just not nice. No, that's okay. Yeah, but this wasn't because of anything like that. This is a reason behind it that, yeah, I'm not going to go into it, lovely, but like I say, I'm not going to keep talking about this because it's really upsetting and it's not the same situation. So, I have walked in the past. Not necessarily. I've been told, my love, unfortunately. And it's quite clear after 8 months of intensive rehab physio. Yeah, bright pink propranolol, I know it is. I was on propranolol beforehand. Oh, Rosie, I literally do. It's so frustrating. I've said, like, you know, I don't want to talk about this, whatever, and people carry on. Just like, okay. People don't know my conditions, they don't know what caused it, and I'm not going to say because it's upsetting. And, you know, yeah, whatever. That's not your fault, Stacey, lovely. It's fine, let's just move off the subject, please. I try to have the patience, but it's wearing thin now. What are my hobbies? I do a lot of colouring, lovely. Or to make them bright and colourful. Some of them are white, some of them aren't. Like, you know, precisely that, Rosie. And I have shared stuff, but then I get it chucked back in my face, apparently. But so, why should I? Crochet. Ooh, I tried to teach myself to crochet. And honestly, I was terrible. I can't show you any colouring right now because it's literally in my bedroom. How often my tube changes? This one's 3 monthly because it's an NJ, unless it moves. This one is monthly. Lollipop stick houses. Oh, that sounds exciting. Embroidery. My mum does a lot of embroidery. She tried to teach me, but again, like I said, I was terrible. Like colour by numbers. Never really tried them, but yeah, colouring in general. You're buying some pencils to oh, that's exciting. I want to get some other new pens. Diamond art, I would need a... So I find I would need probably a microscope or like something to basically zoom in, you get what I mean, to like see the numbers for the different diamonds. And I also feel like you've just seen my losing the screw of my glasses. Yeah, magnifying glass, that's the one. I've just lost that screw of my glasses. Imagine how many pieces of diamond art I would miss. Precisely, I'd lose exactly that. I don't want to lose any more things that then I'll just mess up a picture and that'll annoy me. So an NJ tube is normally 3 months, lovely. But sometimes you can get the 6 weeks, which is the silk tubes. But sometimes places might change it. So it depends on your hospital. Hospitals have different policies. They might only change it if it gets broken, but it also depends on what type of tubes they use. You definitely should, Chloe. Chloe, put some on your gift list, darling. On your wish list that you want. I'll get them. Treat. Have you? Wow. No. Probably 6 weeks. Please, Chloe. Gold, I have gold, yeah. Let me treat you to one thing, darling, come on. I've never pulled it out in my sleep, but actually, regardless, yes, I would have to go to hospital. I do. I'm feeling today, Meg. Okay as I can be. So I can take some liquid by mouth, but this is what this tube for. It drains out. So essentially, anything I take in orally drains out of here. Thank you, Stitch, lovely. You can always message me, love, if you want to chat at all. So it doesn't upset my tummy because literally it drains out. But yeah, pretty much, yeah. I'll see you soon, Stitch, lovely. How do I get hydrated through this tube? Oh my gosh, thank you. Achieved my goal. So right now, hang on, for dry mouth, yeah. Literally, I've got fluids and fidget much. I can't help fidgeting, love. I'm in pain. It's my back. I've got chronic back pain, love. So fidget much is not a cringe. It's also actually called trying to get comfortable when I'm in pain. Does that feed fill me up? No, essentially, but yeah. Literally. Do you have any pets? No, lovely. So what someone was saying about my feed draining out, my feed does not drain out. This goes into my stomach, this goes into my intestines, so yeah. I can't have any pets. I really want, so the cat in my profile picture is the closest thing I've got to a pet. And I love her to pieces. She's so gorgeous. And she comes to my door every day. Do I get hunger pain? No, not really. I get like, this sounds really funny. I get like a severe empty feeling. Oh. I get a severe empty feeling in my stomach, obviously because my stomach never has anything in it. But I also feel incredibly nauseous and pain all the time. Oh, bless. Do I get to go out and about or is it? So I can go out and about with my carers sometimes. It just is risk assessed on the day and how the night's been and how the morning's been. So I would go out for 2 hours or an hour of the 2 hours in the morning with a carer if need be. Do I not wee? So I can have fluid. I do have fluid through my tube. Everyone wees, but I can't go to the toilet like a normal person, essentially. I am obviously a normal person, but I've got a catheter. A suprapubic surgical catheter. What area? East of England. Yeah. So yeah, I've got an SPC. Oh yeah. Sorry, lovely. I wasn't trying to exclude you there, lovely. I'm sorry you've got kidney failure, darling. Bless your heart. So you're obviously on dialysis. Was that you saying that? But yeah, the surgical SPC catheter is a nightmare. Get so many infections. Either UTIs, the stoma site infection, or both. Oh, Lucy, I'm so sorry, darling. I'm sending you love, sweet. Yeah, bless you. There is, yeah. Yeah, see, I retained my bladder. Thank you. I have a lot of problems with mine too. So basically a normal catheter would obviously go up. If my illness is mainly I've got multiple problems, love, unfortunately. I've got multiple illnesses, so how did I get paralysed? We're not talking about that, but it's through my epilepsy, essentially. So I was peg J fed, lovely. But yeah, I had granulation tissue infections and everything, and I get the same with my SPC. And having 2 surgical sites is not ideal when I've already got the SPC to contend with. That is a nightmare, and I've had it 8 years. Nearly 8 years anyway. 7 years for the surgical, 8 years for a catheter in total. That's okay, lovely. SPC, suprapubic catheter. So I can't show you exactly it, but suprapubic catheter goes in, essentially in here. No, unfortunately not, love. My suprapubic has determined the long-term plan, but yeah. Yeah, see, I get Trimovate cream given to me for my suprapubic site. Trimovate is a mild steroidal cream that essentially breaks down the granulation tissue, but you can't use it for long periods of time. Do I get the urge to wee? So this is why I had the catheter in the first place. I retained a lot of urine inside my bladder but had no urge to urinate, was getting a lot of fluid in me, still had no urge to urinate, and unfortunately now they've done tests, they've done urodynamic testing, and found out I've got bladder failure. So my bladder has basically no sensation, and now obviously because I'm paralysed from the lower body, I don't feel it anyway, but I wouldn't feel it now regardless, but I've had the catheter since before I was paralysed. But yeah, so essentially my bladder's paralysed, but that's not the term, it is just bladder failure. The catheter is painful. See, I don't find it painful, but obviously because where it's situated, I don't have the feeling. I can't say never, but they don't expect I will be able to. I've been told, you know, the paralysis is lifelong, but, you know, I can pray and I can hope. But, yeah. How's my sugars tonight? They are going down, sweet, and I can feel it. I might do a finger prick. No, so I can't change the catheter. They did mention it, but it was ruled out, lovely. Mine is complete bladder failure. But yeah, Fowler's was mentioned originally, that's what they thought. But after trialling different medications and different, you know, different types of catheters, different everything, bladder failure. And the urodynamic testing, they pump stuff into your bladder, saline into your bladder. You press a button when you get an urge, and then you have to go sit on a special toilet and see if you can get past it. With certain catheters and bits in you to measure the flow and the output and everything. I had this done twice because they wanted to retest before they did the SPC. And they put 4 litres into my bladder without me feeling it. And then obviously they had to put a catheter straight back in because the 4 litres in your bladder was not good. Sacral nerve stimulator, yeah. It was 4 litres of saline, not quite 4 litres, it was 3 point something and then they stopped, but near enough 4 litres. Only because, you know, you press that button and, you know, it, you press the button when you get urge and when you need to go and all that. But I didn't press the button at all because I had no urge, no sensation, nothing, not even like pain, which was really weird considering I had that much in me. So they just stopped the test and said, we're just going to have to put another catheter in. And this was all the TWOCs I did, so the trials without catheters for, you know, probably about the whole year. They did it so much, but I had a TWOC nearly every month, which is called a trial without catheter. But they couldn't send me home without one because I was straight into retention again. Oh, bless you. Was I born with all these diagnoses? No, lovely. Some of them, not all of them. Kidney damage, oh bless you, darling. I know, yeah, kidney stones are awful. How old was I then? With my bladder? Sometimes. Yeah, so my first catheter was inserted when I was 16 or 17. Can't quite remember. '17 was my first catheter, 18 was the SPC. Something like that. I was either 16 with the, I can't remember the year, but I was either 16 for the urethral for a year, and then when I was 17 I had the SPC. Or I was 17 for the urethral, 18 when I got the SPC. I get mixed up, but yeah. No, I need to because I feel a bit funny. Thank you, Mickey, for reminding me. have a Dexcom, but sometimes it's not that accurate, so I like to measure properly as well. At least once a day. So bless you, yeah. So once I've had, do I forget sometimes? Once I've had, but not much at the moment. So once you get, not always, once you get bladder failure, it's irreversible. So there's not anything they can do, no. They can try things like the sacral nerve stimulator, but yeah. They are getting me a new machine though, so yeah. This is the freestyle one. And meds that need to go in the other box. Bless you. I don't, luckily. Well, they didn't test my urine, but I don't think so. I'm gonna use that. Do you mean the monitor or these? Because this is a Dexcom, but yeah. You can get a rain cover, yeah. For wheelchairs. I personally haven't got one because I can't go out in the, well, I don't go out in the rain, but I'm not sure, Mickey, to be honest. Okay. Yeah, this monitor's alright. These are quite old. They're moving me to an AccuCheck, which is what my doctor's prescribed, but yeah. This one was just actually self-funded ages ago, and I find it really accurate, so I just had to change the battery once. This was before they started giving me the Dexcoms or Libras, but yeah. You learn to live with exactly that. Oh, bless you. I literally clean my fingers to the max when I do this. So I want to get a proper accurate reading. Chloe, if you need to go to sleep, darling, I'll be fine, sweetheart. Oh, hey, Lucy. Hey, Becky Boo, sweetheart. Hey, Georgia. These ready to wipe, because honestly I've been on blood thinners, so stop bleeding. For a button change. Charlotte, do you have a button? Is that what you said? Bless you. No, we've got cocoa. We've got kiwi cocoa. Kiwi Clo. I actually don't know, lovely. I've never had a button myself. Mine was a peg J, so it had to be done in hospital, but... I mean, I get provided gloves sometimes, but only for my central line. Chloe, darling, or anyone, blood sugar's 4.0. This is to mods, by the way. Weird in the wind, oh gosh. Hey, Lauren. It's got some bleeding, honestly. Oh, Lauren, we love you, sweet. 4.0. No, Bex. Do you think we should treat now? It's going low, darling, unfortunately. Let me check how fast. Yeah, the arrow's let down, so maybe. It's got no sugar in it, lovely, the monster, and I don't absorb any anyway. So this, first of all, is 0 sugar. Yeah. And second of all, drains straight out into this bag. Okay. I'll have a glucose. Becky wants me to. I'll take these 2 halves. I think you'd feel more comfortable with that, wouldn't you, Bex? So yeah. I know what my Becky Boo's like by now, don't we, Bex? She won't sleep if I don't take it. I know what she's like, don't we? Yeah. No, to be fair, I feel like I am dropping. I felt a bit iffy, so I think, yeah. Hey, Blondie, sweetheart. How are you doing, my lovely? Did you get my message the other day, sweetie? This is a 50/50, so I'm just using it, obviously. I sent you a message on FB, babe. Messenger. I sent you a message. I wondered if you were just ignoring me. I got really upset then. I was literally like, oh, she still hasn't replied. And I've been in hospital, which is why I didn't have my phone, but... Drop in, lovely, yeah. It says it's been delivered. On Messenger. Sterile water. I've missed you though, Blondie. Are you okay, sweetheart? Like... It goes through my tube, that's where it's absorbed. Okay. You sure, doll? So this tube goes into my stomach, this one goes into my intestines. So the one that goes into my intestines is how my feed, fluids and anything is absorbed. Blondie, I was really worried I'd upset you, sweet. So yeah, I was just checking on you, but... No, Rosie. I'm so confused what I'm doing now, Jesus. I know, babe, I just, yeah. I just feel like you've ghosted me, like, because I definitely sent one, but I wasn't sure, and I felt really bad, like, because what happened the other night, I was like, oh, so sorry. Yeah. Can I message you quickly now, darling? Blondie, let me just say something. You've got us, sweetheart. You've got us always, Bex, you know that. Confused? I drew up so much water. Yeah, so mine's meant to be 4.5 and below, but I'm low when I hit 4 essentially, and mine does drop fast too, so yeah. So I should really be keeping a close eye when I get to 4.5 or below. So for the lowest, ideally they want 4.5 or above. And for the highest, they say up to about 8 or 9. Normally 8, but yeah. Sorry, I'm back. Keep safe, lovely. Hey, James. Have a good night, Rosie, darling. for your back, sweetheart. You know I am, doll, yeah. Okay, lovely, yeah. Just a bit out of it, sweet, like. I think they've dropped a bit more, but I'll be alright. I've just got the glucose in. You asking me, Becky Boo? You little unicorn. 15-ish minutes. Yeah, as okay as I can be, Stacey Lou, darling, thank you. Hey, Vienna, darling. I thought I was, I just wanted to check. I don't have many subscribers, lovely, so it would stop a lot of people coming in. So I don't think that's fair, but yeah. Unless I really lowered my rate of the subscription and then more people could get in. I don't know. Yeah, Bex, get some rest if you need it, sweetie. I don't know, they won't be automatically any better. I haven't changed yet, sweet. Oh no, what were they before? I can't remember. Hang on. Were they 4.0 before? Yeah, so they're 3.9, but... yeah, they're 3.9 now, but they'll pick up. I need to go through to the other room because I'm conscious about my pressure sores. Get into the pressure mattress now. I'm going to come off briefly and I'll be back because I need to go get on my actual bed. Otherwise I'm going to end up getting sorer and sorer and sorer, and that's not good. I can't even work and don't have a job, so I don't get you at all. Honest to God. That's okay, lovely. I've literally got a cold, like, I don't know what she expects. Anyway, I'm gonna head off for a minute and I'll get into my bedroom and come back, okay? See you in a bit, guys.
The Observer, providing you with the latest TikTok drama from across the UK.